From the data integration perspective, we're very much focused on a solution that we call health analytics. Both payers and providers are now very interested in leveraging the data that's within their application systems and getting better insight on an enterprise scope rather than a siloed information basis. Today we have a lot of healthcare enterprises that have siloed application business intelligence that focus on very specific areas. We're taking more of an enterprise approach that can deliver more value for operations, for clinical outcomes, as well as cost efficiency and compliance and reporting. The benefits of building health analytic solutions for an enterprise are many. And healthcare is a very complex process, and there are lots of departments in healthcare. And the problem today is that it has evolved organically over time, and each one of these departments have built their own siloed applications and have their own data and can share across the enterprise so that everyone can leverage that data into information and intelligence, and therefore provide a more efficient and cost-effective care. What business intelligence and healthcare allow you to do is to automate the process of accessing those fragmented data from those systems, drive the data into a core data repository or a trusted information repository for the whole enterprise. Now you can have the financial department, the HR department, the clinical department, any department in a hospital look at what are the subject areas they would like to start with and build out business intelligence over. If it's a quality and outcomes reporting organization that is responsible for compliance, they can approach the health analytics area by building the metrics for measuring outcomes for diabetics, for CHF patients and AMI patients, or pick your own disease state, if you will. If they're having problems with adverse events, they can instrument the data to provide alerts on a real-time basis, for example. Now that we have the technology to access telemetry from bedside as well as homebound patients. From a cost and efficiency of operation perspective, we can do analysis around length of stay. What are the costs per procedure in one facility versus another, and do more introspection into why one hospital within a network costs less than another hospital in a network, which we couldn't do before.
And so here in Australia at Mater Health up in Brisbane, we have a marvelous example of what George has been talking about. They extract data from their human resources system, from their financial systems. They wrap some forecasting into it to understand how their clinical resources, their nurses, their population is today. Do they have enough people in place? And how that looks going forward. What are the programs they have to put in place to attract the right clinicians for the wards that are going to need them, both today as well as 3 years into the future? It's a pretty good example of how you can gain information from the data that's produced in those systems. George?
Another area that's really interesting and innovative is there's a provider network in the United States that is now delivering warranty-based healthcare. So if we perform a procedure on a patient, like a hip replacement or a quad bypass, CABG procedure, the institution will warranty that service for outcome. And if the patient has any problems, they will repeat or fix the problem without cost to the patient or the government. You can't do that without having some sort of analytics within the institution. So IBM has traditionally been a technology company, and still is a technology company focused on good industry-leading products. But what we're doing now is building accelerators on top of those products to deliver value much faster and benefit the client and the market in a more rapid fashion, so we can get to value in a very scalable and speedy manner. So we're doing things like building health analytics accelerators We're designing data marts that allow us to rapidly build out business intelligence for diabetes, for surgical quality, and so on. That provides the ability for IBM to deliver a solution in 90 days where a client can actually leverage reporting on the data that's within their systems. On the integration side, we deliver a healthcare enterprise service bus, which has predefined common information model for HL7 so that you can now take predefined flows between applications and integrate applications across the enterprise. These are very important examples of how we leverage our underlying service-oriented architecture technologies to build flexible infrastructure and provide more value for the customer.